Welcome back, ACT family. Today on Athletic Conceptual Training, we welcome a true pioneer in the world of veterinary medicine and nursing. Kenichiro Yagi, with over 25 years in the field, Ken has reshaped how veterinary nursing is practiced and perceived. He is the Chief Veterinary Nursing Officer at the Veterinary Emergency Group, aka VEG, or a veggie. Um, overseeing thousands of professionals across the nation. As a program director of the RECOVER CPR Initiative and co chair of the Veterinary Nurse Initiative, his impact spans from emergency rooms to legislative change. Get ready for a powerful conversation on purpose, leadership, innovation, and the future of vet med. Thank you for joining us, Ken.
Thanks for having me.
Yeah. So just jumping right in, I mean, we went through some of your accolades and accomplishments and your title. Let's get to know you. What first sparked your interest in veterinary medicine, and how did that evolve into leadership role in the veterinary nursing?
Yeah, I actually get asked this question pretty frequently, like how I got into veterinary medicine and how did I come to where I am today? And
Hmm.
it actually starts with back in high school
Okay.
when I actually realized that I needed to go to college. And people in my culture think that being a doctor is a great thing, but I had one issue, which was that back then I felt like I didn't like people. And so I know a lot of people say that. Don't worry, like I've changed my mind on that. But so as I was going through my thought process, I thought maybe veterinary medicine would be good. And so that's why I went to UC Davis undergrad, applied to vet school, went to vet school for a year, and I actually ended up dropping out. And that's
Okay.
when I started to work as a quote unquote technician at the place that I got a job at. And then I realized that I actually wasn't a technician, I was an assistant, and there was
Hmm.
something called credentialing. And so that's where I grew up as a veterinary assistant, became a RVT, got my VTS certifications, and somewhere along the way, I got introduced to speaking at conferences.
Hmm.
And that's when I broke out of the four walls of the practice, got to see what our profession looked like outside of my hospital, and then
Hmm.
realized that things were actually not all that great. Um, and that's how I got into advocacy and started volunteering for organizations and started really working towards how I could maybe contribute to changing the environment that we work in, so that the people who do the work that I grew up loving can do the same.
Yeah, amazing. Can you share a defining moment early in your career that affirmed your path?
Yeah, so yeah, it's kind of interesting how you use the word defining moment because I definitely feel like I have one.
Hmm.
Uh, Long time ago, my wife and I have lost our daughter.
Mm.
And that was a process in which we got admitted to the neonatal ICU and then back into the pediatric ICU. And that's where I got to see how nurses actually function, in that they were obviously caring for our daughter, but at the same time, uh, the way they treated us as family members of the patient. Just when we initially got admitted, they welcomed us, saying, "Come visit anytime. Treat this as your home. Bring the books that you wanted to read for her, the music that you picked out for her,
Hmm.
uh, but at the same time, know that we're going to be here taking care of your daughter. And so make sure you actually go home and get some rest yourself so that you're taking care of yourself so that you can be here for your
Yeah.
daughter." And that kind of experience really changed how I think about how we as veterinary professionals should be treating our patients as well as their families. And it really started to make me think about what veterinary nursing really is. And I think my experience and my reflections from that time definitely shape how I approach things today.
Wow. Wow. Um, First off, I'm very sorry. And thank you also for sharing that with us. Um, and I could definitely see um, the thought process about understanding what nursing care looks like. Yeah. Um, how has your identity shaped your journey in the profession?
Yeah, so I think that experience definitely is what um, drives me drives me today, still today. That
Mhm.
uh, I think I started out really thinking about how can I make myself a better veterinary nurse? Like,
Yeah.
what kinds of skills and knowledge do I need to equip myself with? How do I take care of I worked in the ICU where I worked, and how do I take care of the patients? What kind of advanced, modes of treatments, nursing care do I need to bring in? And so that's how I started going to conferences, learning more, going to workshops, bringing those skills, protocols, central lines, things like that into the hospital, and really working with the doctors and the nurses that I worked with to try to elevate care. And that was the path that I took to elevate myself to be able to take care of our patients.
Yeah.
And then somewhere along the way, a supervisor position opened up, and I thought this is an opportunity for me to be able to do a little bit more, have more impact, and help other people do the same kind of work. And so then that supervisor position turned into a co-manager position, which turned into a manager position, and then joined the part of the practice leadership team, and that's how I feel like I went up my leadership pathway. And through all that, I mentioned that I started speaking at conferences, and that's where I got to meet other people, colleagues and peers, and people that I call friends that feel the same kind of way, that want to make the same kind of impact, and we all now work together to try to make industry-wide change.
Yeah. Yeah. Well, this next set of questions is titled Impact and Leadership. So, as Chief Veterinary Nursing Officer at VEG, what philosophies guide your leadership across so many hospitals?
Yeah, it's kind of hard, trying to get messages across to a large number of people. But one of the things that we have at our company at Edge, really, which is really cool, is the manifesto. We actually have a manifesto. It's a set of articles, documents that outline our cultural values, and within it is written the nursing philosophy.
Mm,
And the nursing philosophy, if I break it down into the key points, is that as veterinary nurses, we're critical thinkers that know the why behind the what and how that we do. And so that's
mhm,
our clinical excellence. But we not only care for the patients in the physical sense, but also the psychological and mental health, emotional well being of our patients. And then our care extends beyond our patients and actually extends to the family members that come with our patients.
mhm.
Uh, and beyond that, we really should be looking out for each other, having each other's back, lifting each other up instead of tearing ourselves like each other down. And that kind of stuff is written into our manifesto that people look at on a day-to-day basis as they huddle in the hospitals.
Yeah.
Um, and so I think that's how we have certain philosophies, values, ethos that are communicated to the people who work at our company.
Yeah.
And if I could spend a little bit more time on this, another really important philosophy that we instill in people, and everyone subscribes to this because it resonates with them, is something called the culture of learning. And that's something that I feel like I champion quite a bit, in that we're all, on a journey that we all have still something to learn, probably something to teach each other. Paying it forward and helping each other is the way to go. And that's just another example of, there's a lot more to this, obviously, but another
Sure.
example of philosophy that we convey through this great manifesto.
Yeah, I can see how that will foster an environment for learning and growth, and just having that as something to aspire to, and just like clear goals. I
Yeah,
love that.
absolutely.
hmm Um, how do you support and empower veterinary nurses to perform at the top of their license?
Yeah, and this is such an important topic for our profession that we always talk about, and I think there's a lot of people rallying around us saying that veterinary technicians, veterinary nurses should be able to perform at the top of our license, and that really comes down to really knowing where the ceiling is and
hmm
continuing to raise that. So one of the things that I'm focused on today, right now, in a very heavy fashion, is something called the Advanced Nursing Training Program.
hmm
So what this is that we've looked at a short list of advanced procedures that our nurses would be fulfilled in being able to perform, which happens frequently enough in the hospitals that would free up the doctor's time, and also has an opportunity to improve the quality of care for our patients, and would be helpful for our business too, in terms of generating some revenue in the right kind of way for the procedures that patients need. And so we targeted urethral obstruction cases as one of
Okay.
our first things to look at, meaning that we're teaching our veterinary nurses to unblock cats and do sacrococcygeal blocks, so
Oh
that
wow.
yeah, pretty cool, right?
hmm
We're able to have nurses be able to take over the cases, being able to do the risk assessment for that particular patient, what kind of treatment needs to be done, should be recommended, and then thinking about a good form of pain control, which includes sacrococcygeal blocks. And unless the patient's really in a dire situation where just getting the unblocking done is the priority, they really
hmm
would benefit from getting that pain management. And
Right.
that's the quality improvement portion that pretty much every patient, depends on who you ask, but 80 to 90% of our block cats should be getting the sacrococcygeal block. And we know that we're not anywhere close to that, which means that
Right.
there's an opportunity for improvement there. But being able to set up clinical guidelines, which talk about the expectations that we set and the standards that we set, and then turning that into clinical algorithms that help nursing team members make the decisions that they need to make based on the assessment of the patient that they're making and the communication network they're having with the doctors, and then packaging all that up to standardized training so that people are trained in a more formal or official way instead of just learning on the floor and learning on the job to do this, knowing
Yeah.
what goes into this, so that people can really, like, the doctors can trust the nurses to safely perform these procedures is how we're trying to promote better utilization and raising that ceiling by doing that with some of these procedures that are normally not done by nurses.
Yeah. I love that. I mean, that just gets me excited as well because the more we know, the more we use the skill level at the top of these individuals' licenses. It continues to, I feel like, validate and give us more of a leg to stand on to push for, salary increases and insurance and things like that.
Yeah, definitely. And I think, when you say top of the license, this is something that I started to think about because depending on who you talk to, even if somebody is very supportive and says, yeah, like veterinary technicians or veterinary nurses should be able to perform at the top of their license, if their vision of top of the license is different from where the actual line is,
Yeah.
it's not really pushing people to do more or do more advanced things that fulfills us. And so that's one of the things that definitely trying to tackle here as well.
Yeah, standardizing that top of the line.
Yeah.
Yeah. Speaking of that, you've championed big changes in our field. How do you navigate resistance to innovation and still move forward?
Yeah, I wish I had a good answer for that. It's a hard. I think one of the things that I tend to do is I definitely ask the question why. Like why does someone feel this way? Why do you think this particular path wouldn't work? I think seeking to understand is really important, right? So asking the
Yeah.
questions, what are they thinking? What's the reasons why there's a hiccup in their mind in terms of this something great that could potentially happen be something that they think they can't happen. So I think as I have these conversations and ask these questions, I realize that when people say like that can't be done, I realize that what it actually means is something like, I don't like that idea because of X, Y, and Z. Like there's different kinds of reasons why they think it won't happen. And so if we can get down to that, what X, Y, and Z is, then we can start figuring out how do we get around that? What are the solutions? And we can turn around that thought process of that can't be done to that can't be done that way. So then let's think about what's the way that it can be done. And I have conversations like that all the time.
Yeah. What's a success story from Veg that captures the heart of your work?
Yeah, when I think back on my time at Veg, it might surprise you, but I would say I can't really say that it's necessarily been all that successful.
Okay.
Meaning that trying to make change for the better for our veterinary nurses and assistants, that's also mind blowing for the industry, isn't like always easy. So there's just as many like failures as there are successes, I think, as we think about the different kinds of things that we've done.
Yeah.
But I think we've definitely approached things by thinking about how we can change the norm. When we changed our pay scale, we started by asking the question, like, how do people need to be paid to have a career? Instead of asking ourselves, what are the other people paying people and how do we beat them? Because that's the wrong way to think about it. Thinking about our use of the veterinary nurse title, it's really about giving people a place to stand tall and not have to be really apologetic about who they are or who they see themselves as. And of course, we did the due diligence, legally speaking, and we have a great partner in the Chief Legal Officer that helps us navigate this space. But that was the question about how do we let people be proud of who they are. The advanced nursing training thing that I talked to you just about is having our nurses do the things that are normally done by doctors, but how do we make it a norm? Or how can we get a quote unquote ordinary veterinary nurse to perform these procedures is how we approached it. So what's the right guidance? What training is needed? How do we foster a good doctor-nurse relationship? And just tackling those issues one at a time. Yeah, and so there's like different kinds of examples like that. I don't know what stands out in your mind regarding some of the things that we're doing quote unquote successfully, but it's really about challenging the norm.
Yeah, I think one of the things, particularly in this interview, that I've picked up on is your use of veterinary nurse and not veterinary technician. And I think, that subtle, specific designation to that name is really important. And for all the people in vet med, I know you probably paid attention to this, but people who don't understand, we are veterinary nurses, what registered veterinary technicians should be called, in my opinion. And yeah,
I'm right there with you, and we can champion that together.
All right, yeah. Next segment, advocacy and education. The RECOVER CPR Initiative is game changing. What inspired your involvement, and how has it grown since you started?
Yeah, my first encounter with the RECOVER guidelines was back in 2012, where I went to a conference called Evidence-Based Veterinary Medical Association Symposium. And that's where Dan Fletcher, one of the co-founders of the RECOVER Initiative, came and talked about the RECOVER guidelines. And he talked to us about how the guidelines were created, how they did the evidence evaluation, and that's how it turned into this guideline, and here's what the guideline says. And I remember looking at, like turning to my colleague that was there with me from the hospital that I worked at, and we just looked at each other and said, we have to take this back to our hospital and we have to do CPR training based off of it. And that's when we decided to create training for it based off of the guideline. And that's because CPR back then was very chaotic. Sometimes it went well, sometimes it didn't go so well. When it went well, it's because you're working with a small group of people, because you're always on a night shift and you work with the same doctor every time, and so you know how CPR runs. But if it's during the daytime where there's a bunch more people and you don't necessarily know how the doctor wants CPR performed and things don't click very well, people are raising their voices at each other, we lose the patient on top, emotional toll that we experienced because of a situation like that was something that we really wanted to change. Which is why we took the.
I love that. Let's talk about the Veterinary Nurse Initiative. What's the end goal? What's the end goal, and why is title protection so important? And we touched on that a little bit.
Yeah, the Veterinary Nurse Initiative is really about standardizing our credentials. And when we say that, we mean by, in terms of credentialing requirements, being able to have clearly defined scope of practice, what we can do because we're licensed, and then having title protection and recognition for that title, and ultimately being able to achieve the title change to veterinary nurse. And all of these things are contained within the Veterinary Nurse Initiative. And something like title protection is really important because it really provides the recognition for the people that are credentialed, who are committed, they went to school, they passed the national examination process. They are the ones that know the why behind the what and how, and they have foundational knowledge towards that. I know there's probably some tension between credentialed and non-credentialed people working in the field and doing similar jobs. But what I think the credentialing really brings is that it allows people to grow faster and farther because of these foundational knowledge that they took the time to go through school to obtain. And that's what's going to ultimately bring the recognition to the profession, that the title equals the education and the training, the commitment, the dedication that makes us the professionals that we are.
I agree. And for all those people watching, there is a difference between a registered veterinary technician and a veterinary assistant. Next question. For aspiring leaders in vet nursing, what gaps in education or mindset do you believe must urgently be addressed?
Yeah, I think education, or maybe like the term might better be termed as training ourselves to look at matters more factually and critically, to formulate our own opinions, being able to have a real conversation, even when we have differences of opinions, and being able to discuss things through. I think there's a good amount of emotion surrounding the issues that we have in our profession today, but unless you educate yourself on the background information and the actual facts, I think it's very easy to be just pushed around by other people's opinions. So, so the ability to do that research and formulate, I think, is very important. And in all of that, I'll just say that, when you're out there, be careful not to get bullied by people who have very strong opinions, but in turn, also don't become become the bully that forces your opinion on other people either.
Agreed. Agreed. You've spoken all over the world. What are the universal truths you've observed across the veterinary profession?
Yep. I think this is something I come to myself as well. I think that people don't realize that we're actually all in it for the people in veterinary medicine. It's really about the connections that you make because you have common interests, passions, being a part of the community who wants the best for the people and the animals that we're caring for.
Mm-hmm.
Uh, and the care that you have for your colleagues and each other is actually something that I've seen shared across everyone that I meet across the world. And
Yeah.
so probably just don't know it yet if you don't feel this way, but you're actually staying in veterinary medicine because of the people.
Yep. Wow. So true. What does the future of veterinary nursing look like to you in 10 years?
So many wishes. I mean, starting with some of the basic stuff, I think credentialing should be better standardized. Hopefully, we're getting closer and closer to it because we see that we see changes every year that
Yeah.
take us towards it. But in 10 years, hopefully, it's all standardized. Veterinary nurses all over the place are being utilized to the fullest potential would be what I'd like to see. I'd like to see a place where people see it as a career because uh, we've gone through that evolution of our philosophy from thinking about this as veterinary technology to actually being veterinary nursing.
Yeah.
Uh, and then at the end of all that, I think I remember a time when I was in Japan speaking for the Japanese Veterinary Nurses Association, and one of the hosts actually asked me, do you feel like you can, if your child came to you and said they wanted to be a veterinary nurse, could you wholeheartedly like be happy when they say that? And honestly, I like hesitated in that moment, and this was probably a little bit over 10 years ago. But in another 10 years, hopefully, this will be a profession that everyone would be proud to recommend to our kids.
Mm-hmm. Mm. That's that's powerful. If you had 30 seconds to speak to every vet hospital owner in the country, what would you say?
Every every owner in the country. That's great. I think I would want to say that actions speak more than words, meaning that I think we all could do. I mean, keep talking about how much you support veterinary nurses, and give us the credit that we deserve and all that, but take the actions that actually support us.
Yeah.
I think I'm lucky enough to work for a company that actually believes that we are nurses and pays veterinary nurses like nurses and fights alongside us for the profession.
Mm-hmm.
And that's the kind of stuff that we should see from every hospital owner, everyone in the industry who say that they support our profession because that's what we need.
Yeah. Definitely. I'm just gonna say veg is definitely unique in that way, and we definitely would like to see that more standardized. Closing questions. Got some rapid fire questions for you. What's your go-to way to decompress after a tough day?
Right now, it's jumping in the pool with our daughter.
Okay. Coffee or tea?
Coffee.
Okay. Emergency shift or teaching day?
Oh, that's so hard. Um, Emergency shift if it's something like a ventilator case, and,
Okay.
but mostly teaching days these days. I really love being able to um, see like people get so excited about achieving another like set of new skills. So really love
Yeah.
that.
Awesome. And what's one book or resource you think every veterinary nurse should read?
Um, hmm. I don't know if I could say there's one book that every veterinary nurse should read. Yeah, I'm stuck. Read, I think that maybe I'll say that there is this Bible called the Textbook of Veterinary Technicians and Veterinary Nurses that was started by McKernan, which is the Bible of veterinary technology and nursing. So
Okay.
maybe I'll put that out there as something that every veterinary nurse would not, grow up without.
Got it. Well, thank you. Your journey reminds us that leadership isn't just about titles, it's about advocacy, service, and vision. Whether he's pushing for legislative reform or mentoring the next generation of veterinary nurses, his influence echoes across every corner of our profession. If you're listening and you're a company that supports pet healthcare or veterinary excellence, this is your cue to invest in voices like Ken. Because when we uplift leaders like him, we uplift the future of veterinary care. Thanks for taking time to talk with us and share your wisdom.
Thanks again for having me. This was great.
Yeah. You guys will be getting this out shortly. We'll get clips out and then we'll post when the full video will drop. Everybody have a happy and safe 4th of July weekend. And this is Athletic Conceptual Training with another great interview from industry leaders like Ken. Shout out Veg. I might need to go read that book because I am gonna take I'm going per diem at Veg, so I gotta take my my test. So, here we go.
Let me know how you like it.
All right, all right, guys. Have a good day.